It is a privilege and a pleasure to be here this morning. And I say that because, first of all, this is kind of like going home a little bit for me. I spend a lot of my time, as you might expect, in a lot of urban areas. In fact, I spent the last two days up in Chicago and traveled the country for Springbuk, calling on brokers, TPAs, consultants, clinicians, all of whom are showing a real interest in our platform, and so I go around explaining that. But truth be known, I'm an Illinois boy from way back. I actually grew up about 2 hours north of here up in Ottawa, and have been gone from there for a long time, but it's always great to get back again. I still have family there, my parents and a brother still up there, so always good to be back in Illinois. And it is good to see that spring has finally sprung. I've been going back and forth right now from my current home in Phoenix, Arizona, to where Springbuk is headquartered in Indianapolis. And I was here 2 weeks ago, and it actually snowed, and I just had to scratch my head a little bit and wonder, why am I doing this exactly? But anyway, it is certainly a pleasure to be back here, and I do want to tell you a little bit more about data analytics, which I know that's like everybody's favorite topic, right? It's really exciting. So Bill charged me with the task of try and make this as riveting as possible. So I'll do my best this morning. But the good news is that, as you can probably imagine, I'm not a Les Mills instructor, and so there's no chance we're doing any burpees or anything of the physical nature. But I do hope to engage you a little bit with on the mental side, and hopefully show you some things that I think are really going to help you as employers as we talk about data and how we manage that and how it relates to how we run our employee benefits plan. But let me just take a couple minutes and tell you, first of all, again, a little bit how I got to Springbuk, because that's kind of, I scratch my head about that as well, and sometimes can't believe that I'm doing this now. But it did come as a result of my past background doing a number of different things. And again, I'm not going to bore you with the details, but I'll go back to my childhood. No, we're not going to do that. But I did actually prepare way back. I went to college to actually be a teacher. Can you imagine that? I know we have some educators in the room, and God bless all of you, because that's a great thing to do. I did it for 1 year, and then knew that that wasn't what I wanted to do for the rest of my life. And so I tell people I got tired of standing in one room all day long saying the same thing 5 times a day to people who didn't really want to hear it, because I was teaching high schoolers government and history and economics. Some of your favorites at age 17, weren't they? Yeah, those topics not exactly riveting either. But nonetheless, I knew that I liked to present, I liked to learn new things, and I liked educating people. So I figured I'm going to go into corporate sales. And so somehow I first started selling copiers, and then I defaulted at some point into insurance. Because let's face it, other than Bill maybe, and now Travis, no one grows up saying they want to go into insurance. Okay, it usually is something we default into, and then we find, hey, this is really a valuable service that I'm providing, and it provides a good living. I think I could do this for a while. And so after 10 years on the, first of all, on the employee benefits side with the carriers, and some of that was with Blue Cross Blue Shield of Illinois here, the last 5 years, I then jumped off and became an independent broker and consultant and spent the next 20 years doing that. And so it was just last year that I reconnected with an old friend of mine who was also a former broker, but who had started this thing called Springbuk about 5 years ago. And I just happened to see on a LinkedIn post that he had celebrated, or the company had celebrated rather, their 1,400th customer. And so I just reached out to him and I said, hey Rod, congrats on the success. Sounds like this is really taking off. You got a role for me yet? And I was just joking. And he called me literally within 3 minutes and said, are you serious? He said, because I really could use somebody that has your experience in the benefit planning process world as a broker and consultant. I really need somebody to take this to that community. And so after talking through it and seeing the platform, I have to tell you, I just kind of fell in love with it. And obviously you would say, well, you're a little biased. Probably a little bit now, but I understand the solution. I understand why it's so important. So first of all, let me ask you a question. Because some people ask, well, is there really a need for this? Why do we need data analytics, health intelligence? Well, let me ask you a couple. Well, before I do that, let me just tell you, this may come as a shocker, but as a country, hate to break the news, we're sick. Okay? 1 out of every 2 people now suffers from some kind of a chronic condition. Okay? And there are many others who have conditions that will someday lead to a chronic condition if nothing is done. So I think all of us, especially if you do a little bit with benefits, know that there is a need for us to try and get our hands around what's happening. And the way we can do that, first of all, is through data. Okay? Secondly, I would tell you that the system is broken. Anybody agree with that? No, nobody. Okay. 3 people agree with me. That's good. So yeah, the system is broken as far as what we're doing, how we're doing it, and most importantly, how we're funding it. I think the finance side of it especially is a big problem with it. However, a lot of people don't really understand how involved they are in this. And so I saw we have some educators here, some people from the business world. I met a couple of people from the car business. How many people here are in the healthcare business? Just raise your hand. Be proud. Not very many? Well, I would contend. How many of you have an employee benefits plan? Okay? You're in the healthcare business. Okay? If you have an employee benefits plan, you are in the healthcare business. Okay? And it's your job, and you know this, to help not only create quality benefit plans for your employees, but also to contain cost. Because employee benefits now are usually the number 2 cost on the line, the budget line for most companies behind payroll. Right? You agree with that? So everybody knows that for the most part, these benefit costs are only continuing to climb. We continue to see year after year escalations. We had some new things that came into play, and I'm not going to get political, but the Affordable Care Act certainly changed things. Some would say there were some improvements. Definitely. There were some areas that perhaps were improved, but it certainly was not cheap, and it did not save money. And it continues to not save money, and we're going the wrong direction still. So we've got to have something to get our hands around this so that we can try and control the costs. And I would contend that health data, health intelligence as we call it at Springbuk, is one of the keys to doing that. So I'm just going to kind of go through a brief history of where Springbuk came from. And then what I really wanted to do, and it's why I required a minute to get set up here, is I'm going to actually take you through what we call our online demo. So we're going to go into the internet, we're going to go ahead and hook up, and I'll take you through an online demo for a few minutes, show you some of the facets and the modules involved in the tool, and then at the end I'll leave some time for questions before we have our partners come up from Group Plan Solutions and tell you a little bit about the services that they offer. Okay? All right. Well, the Springbuk history really goes back to that friend of mine, Rod, who I connected with last year. And it was at the time that he was actually a broker in Indianapolis, which is where Springbuk is headquartered, by the way. And he had actually sold his agency to a large national brokerage firm, and he had the opportunity to walk away and didn't have to be involved with it anymore, which that's kind of a nice benefit sometimes when you have that opportunity. But he still wanted to be engaged somehow in the same type of business. And so he spent about a month or 2 trying to figure out what he was going to do. And Rod had been one of these guys who was an early adopter of the whole wellness initiatives. And I think most of us in here, if you have employee benefits, how many of you have a wellness initiative in your companies? Quite a few. And he was one of the early adopters of that whole movement towards trying to get engaged with our employees and get them healthier. And so he decided that now that he was out of the insurance business, he wanted to do something specific to wellness. And so he hooked up with an old friend of his who came from a marketing agency, and they started something called the Healthiest Employers Awards. Has anybody ever heard of those? No? A couple? Okay. It's kind of a rubric that has kind of moved across the country. It's now in 48 different cities across the country. Really caught on in a lot of the big urban areas where employers would have kind of a matrix, a rubric, where they would compete to qualify as a healthiest employer by making sure that their employees were qualifying a number of criteria, and then from year to year they would measure them to see how they were improving relative to a lot of biometric screenings and wellness criteria. And so it was from that that they started to really get some traction. And after a couple years, that had really taken off, but a lot of the C-level executives and business people like yourself who were involved in running those plans said, you know, we really like wellness. We like what you guys are doing at Healthiest Employers, but, and we know that we're investing in our employees, but we would sure like to know if all this money we're spending on wellness is really having any impact whatsoever. Has anybody ever asked that question before or had that asked in your company? Perhaps by a higher C-level person? We hear it a lot. And so a lot of people can really resonate with hearing that. And it was at that point that Rod and Phil decided, you know, we can build something. We can build a data warehouse where we can actually take in claim data, and I'll share with you the other data we take in as well, and then be able to display it in a way that people can follow it year over year and see how they're trending and where the areas of concern might be. And so that, simply put, was kind of the history or the origin of how Springbuk started. It has come a long way since then. Today, we started, you know, with I think 3 people really, and some data scientists and engineers who helped build the platform. Today, we're upwards of 85 employees. Over half of those are on the data side, data engineers, data wranglers, as they're called. And again, people who are much more intelligent than I, and I don't understand all that they do, but I understand how they put the platform together and how it can be beneficial. So what we want to do today is just give you an overview of what that looks like and how we built it and how it works. Again, who we are. Rod was an early adopter of wellness. He then got a lot of feedback about the frustrations that these C-level people were having with wellness, and was it really having an impact? Is there any way to measure that? So again, Rod is really a believer, and it's in our mission statement, and really who we are, that we really want to help employers with data and intelligence so they can actively improve the health of their most valuable asset, which is your employees. Okay? So again, that sounds a little highfalutin, very noble. We would even go a step further and tell you that the ultimate goal is to prevent disease through data. And the way we do that is by drawing attention to certain phenomena or trends that are going on in your group so that you can put some real focus there and know where to invest maybe in some care management, some intervention techniques. Okay? All right, so the solution, again, we call it a system of intelligence. It allows employers to discover where the cost drivers are at, areas of concern as we talked about, and then we can target those areas and bring in some intervention or care management people, and truly try and engage with the population. It was originally built for that Healthiest Employers group of employers, which now is about 8,000 employers that compete each year to be on the Healthiest Employers top 100 list. And so because of that, we really designed it to be employer-centric, okay? So some of our competitors have very good tools that do some of the same types of things that we do, but many of them, you almost have to be a data scientist or have a degree in data engineering in order to really be able to mine the platform. And so one of the things that I think differentiates Springbuk is that we really have built it to be employer-centric and easy to navigate, very intuitive, and yet very actionable in the end game as well. So again, you'll get to see a little bit of that as we move into the demo portion in just a second. But it's very easy to use. Again, we use a lot of our database from those Healthiest Employers, which, as I said, is about 8,000 employers now. And then, again, we know that we also have to provide service to our partners, like Unland and Group Plan Solutions, and we work with some on-site, near-site clinics. We also are interfaced all the time with the insurance companies, carriers, and TPA market across the country. So the service side of it is certainly something that we have focused on as well. And so we have full implementation teams and full client success teams that are involved along the way. But the other thing that we really pride ourselves on is our commitment to innovation. And again, I don't want to, throw big numbers out there and try and impress you with anything, but this started as a startup 5 years ago, and after a year, we had built it to a point where some venture capitalists came in and seeded us with the first $4 million continued to build it out. And then just recently, we went back through our second round, our Series B funding, and we had 76 venture capital firms that wanted in and wanted to get behind Springbuk. And so we were able to vet them, get it down to 12, and we actually received terms from 4 of them. And so just 3 months ago, we came into a new $20 million funding of venture capital. But here's what they told us is, we like what you're doing. We love the team you've assembled, but you have to keep innovating because many of your competitors are now legacy platforms that built it, maybe sold it, and now it just exists in its same form that it did 5 years ago. And so as we continue to push the envelope, we're looking for new ways to provide new data, new predictive modeling, which is really the secret sauce of Springbuk. Because carrier reports, if you just get your report from United Healthcare or Blue Cross or Cigna or Aetna, it's going to tell you what your claims were. But that's what we call static reporting. It doesn't tell you any more than what happened. What we want to know is what's going to happen. And so the predictive modeling side of what we do, which actually incorporates some AI, artificial intelligence, in doing a lot of the predictive forecasting, that's really where the future is going in this, okay? So, again, how we do it, first of all, as I mentioned, we actually hook up with the individual carriers, TPAs, pharmacy benefit managers. We actually can take in data from the biometric vendors to the extent that they can export it to us. We can consume that data. A growing trend in the enterprise space today with really large employers is a trend toward what we call not only direct primary care, which you may have heard of, but also on-site or near-site clinics, where large corporations sometimes will actually put a PA within their company location to do primary care type of things for the employees and their dependents. So we can export that data to the extent that they have the electronic medical records which are able to be exported. We can consume that and include that on our platform. And then also we take in biometric screening vendor data and then payroll and eligibility data. And that's important because it allows us to really drill down into the individual member level, especially as it comes to claims. And when we talk about forecasting, I'll tell you why that's so important. So there's really 5 primary sources. Obviously the medical carrier or TPA, the pharmaceutical benefit manager, and that's where the bulk of the cost is at between those two. But then on-site, near-site clinics, biometric screening vendors, and then payroll and eligibility files. So we also have the ability to customize and also build in some other things like dental, vision, workers' comp. We can do some reporting there even. And then if somebody has a homegrown system or some type of other system, we can usually find a way to interface with that as well. So we really like the idea that while we do have a standard platform, we can also customize and do some special things for those clients who have special desires and requests. All right, so I'm going to switch out here for a second, and hopefully I'm tech savvy enough to switch over quickly and get us, lost my mouse. All right, so the Springbok Platform, this is kind of a sample of what it would look like if you were a consultant, a broker, a TPA, and you had multiple employers who were all on the system, okay? 2 things to remember about the system. First of all, it's a cloud-based system, so there's nothing to download or put on your own internal computers. And then you can access it from anywhere that you have internet access, which I think that's pretty much everywhere today. But we also protect it, and we can provide different levels of access to the platform based on the authority of the people that are viewing it to see the information that we can display. Let me explain that a little bit more. So consultants, advisors, TPAs, insurance company carriers, they all always like to see right down to the member level as much information as they can. Some HR administrators really like us to limit the amount of PHI or personal health information that is shown. Okay, so we can do this in a de-identified type of model, but it really makes sense to have full PHI for at least those people who are going to be help directing the care management that will come out of this. And again, that's another thing we were talking last night a little bit, Bill and I, and one of the things that often gets asked is people see it and they say, well, that's great. I love the data. What do I do with it? you've got to be committed as an employer to perhaps even having to invest a little bit more money in care management, disease management, some type of intervention to try and engage people and get them on the track to better health. And so if you're not willing to do that, then I would contend having the data may not be all that helpful for you. But again, for those employers who are willing to look at it, the dividends have been already, we're hearing people who are telling us how much they've been able to control the spending and more importantly, engage their employees back into returning to better health. So I'm going to jump into the demo. I think we've got about 25 minutes left, and kind of show you how it works, okay? So again, it's cloud-based, it's roles-based, so again, we can limit the amount of information that certain people see while giving other people full information to see that same data. But in order to get at the care management, we're going to assume today, and again, this is all hypothetical, it's not a real group, so the producers should not be writing down these names, so they're going to go call on these or anything. It's just been mocked up. So just for sake of argument today, I'm going to let you peek into the full PHI model so that we can see kind of what that looks like. All right, so assuming this is a TPA or broker that has all of his employers here that are in his client base, we're just going to click on one. Again, it's going to show you, I'm going to see if I can, nope, didn't. So this would be the login page where I'm going to go into my screenshot here and be able to, well, all right. I don't know how to move that because I work for a data company, but I'm not the most tech savvy guy in the world, believe it or not. So anyway, you'll get the picture here. Right away, people see, oh great, I get to see my claims. And we know people like to see claims, so we put that front and center on what we call the home page or the Health HQ page, okay? So here, what we're looking at is we're looking at the current 12 months of claims data right here. And again, here, you've got your previous 12 months of claims data. So in order to really populate the platform fully, we're really asking and trying to get 24 months of aggregate data up front to populate the platform, okay? And again, we're drawing there, we're creating EDI feeds with the medical carrier, the PBM, the biometric screening vendors, on-site, near-site clinics, and payroll and eligibility. Okay, maybe I can reduce that. Does that help? Not a lot. So again, what goes into this? Well, again, a lot of people like to see just graphically. It's kind of pleasing. We draw out. So if you want to know as an employer where did it go, we're going to give you kind of a bubble graph here. So you can kind of hover on this. It's very interactive. So we can see here, you know, there was 133,000 of chronic obstructive pulmonary disease, or COPD. Preventive health amount, gastrointestinal medicine, degenerative ortho disease, hepatitis. So it's kind of cool to be able to just see graphically. And then in a minute, I'll show you how we go down deeper into this and we can actually see further claims data. Down here, it would be your prescriptions. So you're going to see a lot of your specialty drugs in here, many of which are very effective, but also very expensive. So again, really a great way to just start. Another thing you can do along the way is there's a lot of filtering capabilities. And I can't see the one I want right now. But we can drill down into the sources of care. So whether it was on an inpatient basis, an outpatient, emergency room, ER, urgent care, RX at the pharmacy, we can look at all those different things. But one of the things I want to do here was just go into, first of all, just a little bit of information, and you're not going to be able to see this probably, but this prevention tab here just tells you as an employer how your people are doing relative to their general wellness exams, age and gender specific, okay? So if they're, you know, a 25-year-old male, they're not yet going to be screened for prostate cancer. If they're a 23-year-old female, they're not yet going to be doing regular breast cancer screening. But at 35, that female would be expected to be starting some kind of a protocol on that. And at age 50, the prostate exams would start as well. So we can actually go in, flag the codes that are coming in from the carriers to see who's actually doing their screening, and again, gender and age specific. You can click on this 3 little dots here. It'll give you more information into who's doing what or who's not doing what. So one of the ways that this has been used by one of our clients is they were going to do a wellness fair. Okay, everybody has been in on that probably before, crafting a wellness fair and what we're going to do for it. And they saw that they had 117 females who were eligible for breast cancer screening had not done it. So they decided to bring in a mobile mammography truck for the day, and that went over well. Another client saw that they had a lot of dependent children who had not had their immunizations, vaccinations, and so they brought a PA in, and they did 2 or 3 certain vaccinations to help in that manner as well. So lots of different ways this can be used, but it really is just kind of a checkup to see how your people are doing relative to that. So gaps in care, this tab over here represents what I call low-hanging fruit. As a former broker consultant, if I would have had this tool 10 years ago, when I was consulting with clients, I think it would have been a lot of extra value add that I would have brought to the table. Gaps in care is really identifying people specifically, and this is the drill down into the claims data, that at some point have been diagnosed with a condition or given a prescription or some kind of a treatment protocol, and for whatever reason along the way, they stopped. And they're no longer taking their medication. They're no longer doing their therapies, whatever the case may be. So if we can get these people back engaged again, this is an easy way to find some low-hanging fruit, some money in a savings opportunity way that could help the healthcare spend of the entire plan. It's so important that we actually created a further tab on this where we can actually go in and see the different categories of screening here for chronic and preventive opportunities. So everything from cholesterol all the way down to well child care, and I know that's tough to see. But again, one of the leading causes today of a lot of concern with employer health plans is in the area of those conditions leading to metabolic syndrome, diabetes being one of the chief instigators here. And so we can see here how many people who have diabetes have not been fully compliant with their treatment protocol. And so first thing people ask is, well, what are the treatment protocols? And so we give you that. We tell you down here that this would be everything from an eye exam to regular A1C testing, hemoglobin testing, LDL, HDL, the full scope here. And so we can kind of check and see how many are not compliant based on that. And then again, I'm going to give you the peak here. If you have a care management company like a Livongo who works in this area specifically of diabetes, and you want to engage them and be able to identify who we need to try and work with, then you can click in here and you're going to get down to the member level here. Okay? So again, assuming you have access and authority to view PHI, this gives you a great way to share with clinicians or a disease management vendor who we need to focus on to try and get them compliant with their treatment healthcare regimens. Okay? And then we can go further actually, and there's a member profile here that's built out so that we can see last year what their claims were actually, current and then forecasted as well. And here's the thing on the forecasting. When we did that first snapshot back on the first page, and we talked about the first two, so the previous 12-month period, the current 12-month period in the middle, and then the forecasted 12-month claim total. That's actually not just looking at your current claims period. A lot of underwriters or even consultants sometimes will tell, if you ask them, what are my claims going to be next year, they'll look at your current, and what do? They just apply a general trend factor, an inflationary factor in that geographic area, say it's 6, 7, 8%, and they'll tell you that's about what it will be. This tool, solution as we call it, will actually go deeper with that forecasted, and it actually picks up the codes for what's actually going on in the group, rather than just what went on last year. What are the recent diagnoses? Are there new cancer diagnoses in the group? Are there new specialty medications that have been prescribed? Are there new treatment protocols that have just been prescribed? So we're digging down much deeper into the claims data to see what the actual conditions and treatment protocols are. If someone's going to have immunotherapy or some kind of new chemotherapy, that's going to be a big driver in the healthcare cost. You're not going to see that necessarily in last year's $2.6 million, okay? All right. So gaps in care, it's a great way for people to be able to identify where they want to focus their time and their efforts. So back to that for a second. I showed you kind of some of the criteria for these and why it's so important. The savings opportunities are basically an assumption here about what that could be. Again, it's forecasted actual cost of what usually is entailed with a person with these conditions if their protocols aren't followed. What are the usual claim assumptions that get made here? So again, savings opportunities across the board. Hard to quantify exactly, but we give you an idea of where that low-hanging fruit is at least. All right, the claims tab. I think this is a great one. Everybody, again, likes to focus on claims. So one of the first things we're going to do is we're going to tell you, first of all, your top 10 medical diagnoses by category. Okay? So again, that top one there is a lung cancer. If it was multiple people, it would show multiple members here, but it's all on one member. This guy, Gerson, whoever came up with the hypothetical names, that was a new one for me. But again, we're going to be able to drill down again and see what his claim spend was from the last year and what the forecast is for the current year. And again, he's right in the middle of treatment. So we know that this is going to be someone who's, again, with a 99% risk score here for inpatient or ED risk, emergency room department. So he's going to probably be a high-cost claimant again next year is what that's saying. However, this compliant risk score of 91 tells us that there's a lot of care money to be managed here as well. That if we manage this, it could be less based on how he's engaged with and what the treatment protocols are. Okay, so lots of great information, but you have to be willing and able to go to the next step and put this into place and make it actionable with disease management, with your carriers. TPAs can help as well. A lot of TPAs today have care nurses and so forth who can get involved and really help get people back on board here. All right, so other things on the claims tab. As I talked about, we've got the medical on this side, and then we've got the RX over on the other side. I'm trying to see if I can draw in, but it's not working. Let's do that. So your top 10 prescriptions, and again, we're going to show you in the recent period, and then I can't get it on the screen right this second, going over to the previous, and then we'll tell you a year-over-year percentage increase or decrease in that particular drug. Again, most of these are specialty drugs that are treating, the likes of hepatitis and sometimes HIV, and Enbrel obviously is an anti-rheumatic, very expensive, very expensive. So we're going to tell you where those areas are at, and then try and help give you data to help direct you in your interactions with your PBM, your pharmacy benefit managers, as to what you can do to perhaps bring down the cost of those specialty drugs. But you have to have the data first in order to know what to do with it. So here we're going to give you a 2-year trend on your claims, again, the whole 24 months here. And then in gray, it's the medical claims, the RX shown in yellow there. And if you want to try and drill down into a specific period, then we can pull this across and just look at the last 12 months. We can pull it all the way across maybe and look at the last quarter. And as you do that, it updates all of these claim tabs up above for just that time period. Okay? And then finally, at the very bottom, if you really have lots of time and you want to go into tons of detail on all of your claims, we actually give you all 3,380 claims that occurred in that previous year. And obviously, remember, in orange, those are prescription, and in blue are the medical. If you want to just see the medical, we can deselect the RX, and now we're looking at just the medical categories. So again, we have this second category here, which are disc disorders. You can see that there are 4 different people that had that, 43 total claims, the recent spend, the previous spend, and then we'll also tell you what the year-over-year increase or decrease was there. So again, lots of information there to really drill down deeper. Questions at this point. I'm going to leave time for questions at the end, but does anybody have any questions? I like interaction, so anything specific? Just lots of note-taking at this point. Wondering if it really works.
I'm curious.
Yeah.
Are most TPAs capable of providing this information?
Absolutely. Yeah. I mean, we're going to hear a little bit more in a minute about what GPS can do, but we work with, as I said, probably 70, 75 TPAs, another 100 insurance type vendors as well. So it is not a problem. Again, here's the issue. TPAs, not a problem at all. Insurance carriers sometimes can be a little tougher if you're fully insured. Okay? This tool really is designed initially for self-funded clients. Target market probably 100 and up, and the larger you get, the more impact you really can see on it based on having that intelligence. But yeah, initially there was some pushback on some of the fully insured carriers because they view that claims information as proprietary to them. But self-funding, it's yours. This is your information, and so we've had no problem being able to get those. Good question, though. All right, well, I want to jump into a couple other things real quick. I know my time is fleeting here. For those who have stop loss, which again would be self-funded accounts, we're going to be able to show you here who your high-cost claimants are in a current year. For those who are self-funded, you know what a specific stop loss hit is. So usually on a self-funded plan, there'd be a deductible for the employer on perhaps the first $25,000 of a specific claim. The employer is actually on the hook for that risk, and then there's a stop loss carrier that kicks in over and above that. Okay, so we're going to be able to show you all of your stop loss hits from the previous year, and then going forward, we're going to even give you some forecasted claims on each of those individuals. So again, this is a situation where a TPA or a broker could see all of their different groups and all of the people in those groups who've had a what we call a specific stop loss hit. So what we're going to do here, though, is go back to that CHP that we were working with, and so we'll deselect the others. We'll just hit CHP, apply those changes, and now we're looking at the people just within CHP who had claims that, in this situation, went over $5,000. Now, don't laugh for those who are in the room and no stop loss, because there's nobody who has a $5,000 specific stop loss anymore. Obviously, this was a data engineer who didn't really understand insurance, but he knew how to build out the platform, and so it tells you the information that you need to see here. And where this can become really helpful is when you're looking not only at what the claim was and how much over the excess of the specific, but what the cause of it was, what the diagnosis grouping was. Because this helps you know, as we've given you here, what the forecasted costs are going to be on that person going forward. Because for those who are in the business self-funding, stop loss carriers often will try and increase the deductible on certain people sometimes if they know they're going to be a high-cost claimant, and that's called lasering. Okay? Well, you'd have an argument here if you could see that this guy had all of this claim activity, but it was something that is now pretty much resolved and only forecasted to be another $5,000 worth of claims. Well, you'd have an argument if they tried to laser this individual and say, well, wait a minute here, this was a one and done, there's no further claim activity really coming. In this situation, again, we know that he's right in the middle of this COPD treatment with a lot of very expensive prescription drugs as well, most likely. So his forecasted costs are going to be $112,000 or so in the coming year. They're probably going to put a laser on this guy, and it's going to be hard to fight in this situation. But at least you have the data to know if it's earned or not, so to speak. Okay, if they can really validate what they're pushing here. Okay. So again, stop loss reporting, you can go back down again into the individual level here to see if there's any further care management that can be done. We do have some benchmarking tools as well so that we can show you how your group compares relative to the other Springbuk employers, and then certain TPAs or brokers advisors may have it on multiple groups in a certain geographic area, so they can tell you how you compare versus their other clients in that area as well. So benchmarking is becoming more and more something that we're getting asked about. So again, reports, this is a great one, especially those who are in the financial side or HR side. Oftentimes you may get asked in a spur of the moment, by a C-level person that says, hey, I need to know what our healthcare spend is this year, and I need it in 10 minutes for a board meeting that I have. Yeah, well, you laugh, but that happens, doesn't it? Yeah, I can see the people nodding in the room. Yeah, that happens. So this is a great overview that you can pull up at any time on the financials that tells you, again, the claim summary from the previous 12, the current 12, and the forecasted 12, but also it's going to tell you what your historic claims are. And again, over the 24-month period, it's going to give you month by month what your medical claims are, what your RX claims are. This is a group that actually went from fully insured premium to self-funding in January of 2016. So you see fixed costs then displayed in there, built in to represent the cost for stop-loss premiums and admin fees. I don't know who plotted the budget line, because you wouldn't plot a budget line like that, but you can do that. You can build in what your budget line would be, so you can be able to report how you're doing month to month on all of those topics. Again, we're going to show you here the top 10 RX, the top 10 medical diagnoses. If you have wellness programs, we'll help you be able to see what your engagement level is on all of those members who are participating. And then again, if you are self-funded, this is a stop-loss summary. It shows you your paid claims, those who've had individual stop-loss, and then if you had an ag hit in a year, then it would show in red. You don't want that to happen. So, and then finally at the bottom would just be a summary of your demographics. So you can see here your male-female population breakdown, your average age, and then your summary of enrollment month by month by employee, spouse, and dependents. Okay? And again, you could actually print this page off and hand it to whoever you wanted. You can export it into an Excel spreadsheet if you want to do that. But again, I don't know if we have any finance people in the room. You know, we do have ways that we can go further down into the details of all of the utilization metrics. I'll show you just a brief glimpse of what some of that looks like. Again, this is a claims breakdown over here, which shows you your highest cost claimants, your sources of care in the middle here. So outpatient care, inpatient care, on-site clinics, and then finally your utilization metrics down at the bottom here. So we can tell you how many admits per thousand, which is sometimes a measurement in the industry, average length of stay, readmission rates within 30 days. That's a big area of concern if you're seeing a high propensity for that. And then your RX will show you the average cost per script, and then the per member per month cost per script as well. So again, I think I'm overwhelming you with all of this data. So again, I want to leave just a few minutes here of time for questions before we turn it over to the folks from Group Plan Solutions. So what questions do you have? Do you think this would be useful to have this data? Or just too scary? Again, as a self-funded client, you have the rights to all of this information. It's yours, it's proprietary, and you really need it in order to be able to make decisions on where you're going to focus your areas of care management and disease management. Yeah, Pat.
So for the entire group, we've got different sizes of groups. Some are fully insured, some are self-insured, some are 10 employees, some are 500. How does this software integrate with their current plan, whether it's guaranteed or self-funded, and is there a size, that threshold that makes sense to have this data?
Yeah. Again, I think I touched on it earlier briefly. And, you know, we've got some clients even under 100 lives. Some of those come through a different organization that has a trust, so to speak, and so they have all different sizes, and they put it across their entire trust block of business. But generally speaking, I think 100, it starts to make sense, especially if you're self-funded. But the larger you go, the more it starts to make a lot of sense. Okay, and for those who are in our average case size is probably about 800, 850. And so the larger you get, the more impact you can have on turning the healthcare spend. But that's not to say that a 200 life group can't have impact if they know, especially how the biometric screenings are going and the measurement year to year of how their people are doing, if they're moving the right direction. Because one of the reasons for biometric screening testing, we usually categorize people into one of three categories. So either they're in the healthy category, they're in the high risk category, which would be the two polar opposites, and then you've got these people in the middle who have preventable issues that could be reversed or at least managed with proper care. And so those are really the people we're trying to get to. Because some of the high cost, you know, we want to manage those conditions now, but they're going to be high cost, and we can tell from year to year what the prediction is on them. But the people in the middle, we're trying to get them and move them over to green before they fall into the red category. So, I mean, at 200 lives, that still starts to become very viable as far as a lot of cost potential savings, at least. So, other questions on that?
Well, one other thought is, in our market, those that have direct-to-employer contracting through either one of the healthcare systems, they all talk a lot about their ability to coach. Well, how do we identify who needs to be coached? And so this data right here can be used to communicate with those coaches, get them to a better outcome, spend less dollars as they go along, and rather than have them wander around try to find their solutions on their own, you can use an internal coach and work through that process. So,
Any other questions? Again, I'll stay around over lunch if you want to pull me aside. I do have to get back to Indianapolis later this afternoon, but I'll stay through lunch. And so, if you have questions, you want to kind of pose a scenario to me or something, feel free to do that. Obviously, Bill is becoming well versed in this, and his staff are adopters of the Springbuk program. GPS also has been with us for a while as a partner. So. We're gaining a lot of traction, even here in Central Illinois. We're excited about the prospects. Would love to talk to each and every one of you about whether or not this would be a good fit.